Vaccines save lives. That's an indisputable fact. But in the recent years, there has been an increase in vaccine hesitancy and even reluctance due to myths and misconceptions that have fueled the fears and uncertainty within our community. On this next episode of Ask the Doc, I am here to clear up the misconceptions and answer your questions based on evidence-based medicine. Tune in to this next episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hi, I'm Dr. Scarlet Constant, pediatrician and founder of Constant Care Pediatrics. And today, I'm going to address all of your questions about vaccines, about the administration, preventable diseases, the scheduling of vaccines, and more on this episode of Ask the Doc. We have some questions coming in from Instagram, AllHealth TV app, and Facebook. So send them in and I'm happy to answer as many as I can. There comes a question right now, and we have a question from Harper. Hi, Dr. Constant. I'm a new mom and I thought I was pro-vaccine, but I keep hearing things like vaccines can cause autism or that kids can get the disease from the vaccine itself. What are your thoughts on vaccines, doctor? Well, Harper, that's a great question. These are some of the common misconceptions that have been out there. So as far as causing autism, there is actually no environmental cause of autism. Autism, is a genetic predisposition, and it's actually a developmental disorder. And what this means is this is a disorder where as your child is developing, they are missing some of the milestones that are supposed to be achieved at that time, specifically social milestones. And you cannot cause that by some type of exogenous material. This is something that is genetic and that is already predisposed to happen. With that said, vaccines do not cause autism. And for the second part of your question, vaccines do not actually cause the disease that they're trying to prevent. That is also another misconception. It's not truly misinformation. It's a misconception and a misunderstanding, rather, of the way vaccines work and the pathophysiology behind it. Vaccines are simply proteins that have been generated within the animal models, and they extract those proteins and we put them in our bodies so that our body's natural immune response can respond to those proteins and see them as a disease or as a foreign body and create cells that are created to attack and fight diseases or illness. And once we create those cells, and we call them memory cells, then they retreat and they reside in our body and they are ready to come out and fight if in fact the true disease is presented to us. But to clear it up, a vaccine is not actually an administration of a disease into your body so that your body can fight it. It is actually the marker, or the protein, or the signal of that disease that's been replicated so that your body can identify it and create fighter cells to attack it. I hope that that's a simple response, and I hope that that helps you, Harper. It looks like we have another question coming in from Facebook. Manuel wants to know, Dr. Constant, forgive my ignorance, but I thought measles was one of those diseases that had been eradicated a few years back. If so, why have there been outbreaks recently? Well, you are correct, Manuel. It was eradicated, and I don't want you to confuse eradication with extinction. Eradication is when you actually decrease the incidence of a disease in a community or in a population. So you don't kill the disease, you're not getting rid of the disease. The disease still exists, the virus is still alive, it just doesn't have hosts to pass around, so you don't have incidences, so it's been eradicated. Extinction is actually getting rid of an entire bacteria or virus, which has not been done. Why don't we take a look at this Mayo Clinic video for a little more insight. video about the measles was helpful. And yes, there have been outbreaks. And the reason for that is there have been increases in hosts that are available to get infected with this virus. This is due to decreased vaccination. So if you are not vaccinated and not protected, and there are enough people in a community that are not protected, then therefore you have hosts that are present and the virus can then start circulating again, and then you have a resurgence. So this is why it is so important to vaccinate and for communities to vaccinate as a whole in order to create herd immunity. So we have another question coming in, and that's from the AllHealth TV app. And this question is from Lyle. Dr. Constant, I too was pro-vaccine, but now I have a question about immunity. My friend Vince and his wife Patty were talking about natural immunity versus vaccinated herd immunity. And I'll be honest with you, natural immunity kind of makes sense. Doctor, what's your stance on the subject? Well, yes, in theory, natural immunity makes a lot of sense. Why not let your body naturally fight a disease? But what happens when that disease is just stronger than your natural immunity? And as a consequence, or basically a casualty of war, let's say, you lose a limb, or you're intubated, or you, even worse, you die. Not everyone is going to fight it the way they should, and you can't just fight it and it goes away. You will have complications, some long-lasting, some terminal. So the idea was, why risk or why compromise several people or have all these losses just to have natural immunity when we can actually give you passive immunity and you can avoid being hospitalized or losing a limb or having some type of long-term complication that will really, can ruin your life or a child's life. So that's the reasoning behind passive immunity versus natural immunity. And I just want to add, you're my age and you grew up in a time where we did try to use natural immunity to fight diseases when it came to the chickenpox. And our parents were told, if your child has the chickenpox, it's better to have all of your kids infected all at once. There was something, I'm not sure if you would even know, called chickenpox parties, and parents would invite all the neighborhood kids over so they could all have the disease together and quote unquote get it over with. And they would even put them in the bath and let everybody get infected. Well, today, all of those young children who are now about my age and older will suffer from the shingles. Because if you've been infected with the chickenpox virus, you now have that virus laying dormant in your nerve cells. And as you get older and you're immunocompromised, you can and will develop the shingles. Whereas those children who have been vaccinated against the chickenpox will never, ever deal with shingles in their adult life. So that's a perfect example as to why passive immunity is a lot better than natural immunity. All right. If you guys want to send in some questions or you have more myths and misconceptions that you'd like to be cleared up, take a look at this promo video and see how you can submit your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Okay, so it looks like the questions are coming in. We have another one coming in from Facebook. This question is from Ada. Hey doctor, are vaccines safe for children with allergies or chronic health conditions? And what should I do if my child has a mild reaction to a vaccine? So yes, vaccines are safe for children that have allergies and chronic health conditions. There was an issue in the past where egg allergic children were unable to get the flu vaccine because of a component that would trigger an allergic reaction. But that has now changed. You actually, if you do have an egg allergy, you can absolutely get the flu vaccine and any other vaccines that have egg components, because it is such a small and inactive form of the protein. They will not trigger an anaphylactic reaction. Children with chronic medical conditions absolutely are eligible for vaccines. As a matter of fact, it is encouraged because they are immunocompromised. The only exception are patients that are severely immunocompromised. They cannot receive live vaccines, and live vaccines they're live attenuated, meaning their infectivity is decreased, but they are live. And so children that are immunocompromised or have had a bone marrow transplant, or chemotherapy cannot get these live vaccines, but all other vaccines are absolutely safe for children with chronic illnesses. And just to reiterate, it is important that these children get vaccinated because you do want to prevent them from catching any of these diseases while they are sick with something else. And then the other part of your question was, sorry, you mentioned allergies and chronic medical conditions. And there was another part of your question, let me see. And yes, the mild reaction to a vaccine. So some children do have mild reactions. I'm not quite sure what type of reaction you're referring to. When you get a vaccine, again, our body creates an immune response, which is normal. This immune response is created in order to create memory cells. So an immune response means a high temperature, swelling, redness, fatigue, malaise. All of those are normal, that is a normal reaction to a vaccine, and it should only last 24 to 48 hours. And that is to be expected. Now, if you mean a reaction such as fainting or maybe an allergic reaction, that is something you need to discuss with your physician, because that is not an expected reaction from a vaccine. And that is something you do need to discuss to figure out what exactly happened. There is a very, very small population that will have an allergic reaction to some of the components in vaccines. And if that has ever happened, then you absolutely need to speak to your pediatrician. And in that event, your child might need to get vaccinated in an allergist's office. And there are different protocols as to how to vaccinate when you do have a severe allergy. Again, that doesn't mean you cannot get the vaccine. It just means there is a different protocol for administering the vaccine. Okay, so we have a question coming in now from Instagram. This question is from Gerald. Does my kid really need a flu shot every year? He hates needles. I don't like them much myself. So why should we subject him to that? Why not just let his immune system fight off the virus and be done with it? Well, Gerald, first of all, yes, your child does need the flu vaccine every year because the flu virus strain does change every year. And we have vaccines that have been created at the beginning of each flu season to actually fight the strain, the prevalent strain that is coming out. And so, yes, it is important to get it every year because you're not immune to all of the different strains. Secondly, it is important to be vaccinated rather than have the flu itself, because like I mentioned earlier, sometimes the flu or preventable diseases can cause long-lasting effects or chronic effects. And so if you do get the flu, or if your child gets the flu and gets complicated with pneumonia or needs to be hospitalized or needs oxygen or even worse, gets dehydrated, that is far worse than just getting the vaccine once and not suffering from a very severe illness. If sometimes you can get the flu even though you've been vaccinated, but it's far more mild and you have a far less chance of having any complications associated with the virus. So again, why put your child at risk of getting very sick, hospitalized, or even worse, when you can just vaccinate them and not have to suffer such a serious illness? The idea of not liking needles, that's understandable. Many children don't like needles. But I would say to you as a parent, if you have a needle phobia, the best thing for you to do is to help your child overcome this phobia. Don't perpetuate your own fear and push it onto your child. Why don't you try to overcome the fear together? In reality, you're always going to have to be exposed to needles, whether it's via vaccine or, God forbid, you're sick and in the hospital, and then you're getting it in an uncontrolled situation. So why don't you talk to your child and maybe tell them why it's so important to get vaccinated, and that this is something that's going to help them, and this is something that's going to protect them. So instead of having a negative connotation, there's a positive connotation around it, and that will probably really ease their fear a little bit more. So I think that you should maybe explain those things to your child so there won't be such a fear and such a reluctance against any vaccine at all. Good luck. Okay, it looks like we have a question coming in on Facebook. Ahuva. Hi, Dr. Constant. I know there are vaccinations for RSV, COVID, flu, whooping cough, polio, and so on. But why isn't there one for the most horrific, debilitating, and unforgiving virus of all? The norovirus. Our kids bring it home to us every year like clockwork, and it's the gift that keeps on giving. Yes, Ahuva, norovirus is terrible, and this season it really ripped through the community. And I agree, there should be a vaccination against it. It would be great. There's actually a vaccination against rotavirus, which was also a very bad gastroenteritis that was hospitalizing babies in the early 2000s and for dehydration, and many even died from dehydration. So thankfully, the rotavirus vaccine has come out, and it is part of the schedule. But the norovirus vaccine has not been created yet. And trust me, they are working hard at creating this vaccine because we know how important it is and how devastating norovirus can be. But there are a few limitations right now to creating this vaccine, and that's why it has not been put out. For example, right now, what scientists are working on is, let's take a look at this graphic, is there are very few human studies. In order to create the vaccine, we need human studies. We don't have an appropriate model system. So for example, which animal we're going to use and the model and how we're going to create this. The rotavirus vaccine is actually an oral vaccine that you take by drops. There's also an unknown duration of protective immunity. You know, rotavirus, you just give it the first 6 months of life, and then there's a lifetime immunity. Whereas with noro right now, we're not certain how protective and for how long it will work. There's also antigenic variation among genotypes and genotypes. So what that basically means is that the markers for this virus have been changing quite a bit. And so you really need to localize the most common in order to effectively create a vaccine. There are also unknown effects of pre-exposure history. So that's another one. We don't even know if pre-exposure is going to help, meaning passive immunity, if that's even going to help with future exposure of norovirus. So all of these things are being investigated, and hopefully those questions can be answered and a vaccine will be created. Okay, we have another question coming in. Let's take a look. This question is coming in from the AllHealth TV app. Oh, and it's from Scarlet. Hi, Scarlet. I'm Scarlet. Hi, Dr. Constant. Can you explain the importance of the MMR, measles, mumps, and rubella vaccine? And at what age should children receive it? My husband and I are ready to bring in some youngins into the world, and we're doing our research. Well, the MMR vaccine is actually administered at the 1-year visit, 12 months of age, and then a booster is given at 4 years of age. And the measles, mumps, rubella vaccine is very important. I mean, these 3 viruses can be deadly, and they were very prevalent in the pediatric population, and it spreads very quickly. And that is the concern, is for measles, if I remember correctly, one person can get 10 to 12 people infected in one exposure. So this spreads rapidly. So it is very important to protect against the measles, the mumps, and the rubella virus. Rubella causes a lot of long-lasting effects, and even a pregnant person with rubella, there are many congenital defects that can develop. So this is something that we really want to protect our community against. And good for you for doing your research before your kids come into this world. I think it's important for you to do your research, empower yourself, and really get the knowledge that you need to make informative decisions. I don't think parents should make decisions about vaccinations based on fear, based on anecdotal stories, and based on rumors. I think as parents, it's important for us to do our due diligence and read the facts and understand the benefits and the risks associated with any of the decisions that we're making for our children. Okay, so it looks like, well, we have, if you want to send in some questions, we still have some time. Take a look at this promo and see how to send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Okay, so questions are still coming in. I think everybody just really wants to get their information and make the right decisions for their children. It looks like we have a question coming in from AllHealth TV from Rohit. Hi, doctor. Would you mind giving me, us, a brief review of the birth to 18 immunization schedule? I went on the CDC website and it's a little confusing. I originally thought that our pediatrician's office would reach out and let us know when our child needed this or that vaccine, but now I'm guessing that we need to be a little more proactive, correct? Well, Rohit, yes, you're right. So, it is important for the doctor's office to actually, let you know when to come back for your visits, when your child is due for vaccines. And I can't speak for your doctor's office or all offices, but I will say that we try to do our best, try to put a recall system in place. And most importantly, when you leave your appointment, especially if you have a child under the age of 2, you should never leave the office without a follow-up appointment. If you're in your doctor's office and your child is under the age of 2, truly likely you need to come back, whether it's in a month, 2 weeks, or 2 months. So try to make a habit of not leaving your doctor's office without a follow-up appointment. With that said, vaccinations are given typically at the 2 months of age, 4 months, 6 months, 9, 12, 15, 18, and 24 months. Usually the vaccines are completed by 18 months of age, but there might be some stragglers, maybe missed appointments that will be completed at 24 months of age. But that's the general schedule for the pediatric population. And it is good for you to be privy to the schedule and just kind of glance and see what to expect. Every office differs in, there are windows when you can give the vaccine. So for example, if you can give a vaccine between 12 and 15 months, one office might give it at 12, another office gives it at 15. So you want to be familiar with your office's vaccine schedule. And also we have different brands and combination vaccines that vary from office to office. So while one office might give 4 vaccines at a 2-month visit, another office might give 2, and that's because they buy combination vaccines. So these are all things that you'd want to discuss with your pediatrician and just, peruse their policies and their schedule so that you are familiar and you know what to expect on your next visits. Okay, we have a question coming in now from Facebook. It's from Eden. Dr. Constant, we're gearing up to take our youngest Jacob, age 5, to the first memorable vaccination visit, chickenpox. Unfortunately, his older siblings have gotten wound up about getting the shots. How can we prepare Jacob for getting vaccinated and reduce his anxiety and discomfort? Well, I think the first thing is, I would love it if we can all stop calling them shots. It's such a terrible word. It is scary. It sounds almost violent. And they're vaccinations. They're vaccinations that are injected via little tiny syringes, and literally the needle is like a little butterfly. We put them in babies. So maybe we should tell him that he's getting immunized at his next visit, and you can explain to him what an immunization is and why it is important to be immunized and how you're doing this to protect him and because you care about him and his doctor cares about him. And these are all good things. And he's going in to an important visit. And now he's going to be, I think for this, the varicella vaccine, that's the 12 or 15 month. So he's a big boy and he's strong and he's brave and he's doing the right thing, rather than telling him he's going to get stabbed with a shot or a big needle, which kind of has a bit of a negative connotation to it. So I hope that works, and I hope it's a successful visit. Okay, so I think that we have another question. Let's see. Yep, we have another one from Clark. Hello, doctor. People keep asking me if I'm going to get my kids vaccinated for COVID-19 again. But the twins, Louis and Louise, are teens now, so they probably don't need it anymore, right? Well, Clark, that is wrong. The COVID vaccine, COVID, like the flu, is now a virus that is here to stay, and it has been it has been transforming, and so we do have many different variants of the COVID virus. So what happens is they've created a vaccine for each year, each COVID season, let's say, that addresses a different strain. So just like the flu, now we do need a COVID vaccine every season. So I suggest that the twins get their vaccine. Okay, there's time for one more question. Blossom, she wants to know, hi, Dr. Constant, can you explain the difference between live attenuated vaccines and inactivated vaccines? That is a great question. A live attenuated vaccine like varicella or chickenpox is actually the live virus, but it has been, the severity has been decreased and altered chemically so that it's not so virulent, and we can create an immune response to that. An inactivated vaccine is what I discussed before, where it's just the protein and we inject the protein and we create a response to it. This was great. I hope that I cleared up a lot of the myths and misconceptions that are associated with vaccinations. I hope that I helped you new parents make informative decisions for your children and families. And if you have any more questions, please feel free to send them in and I will answer them as soon as I can. Take care, everyone, and have a great day.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.